Good morning. Thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County. And today I have to my right Katie Tolley, who is the Director for Advancement and Marketing at Maddie's Place. And if you have not heard about Maddie's Place, I'm glad you're here because it's something that everybody should be aware of as a kind of unique asset in the community that a lot of people know about, but a lot of people don't know about, and that's what we're here for. So thank you for being with us today.
I'm thrilled to be here. Thank you.
So I just said Maddie's Place, and some people are going, what is Maddie's Place? Can you tell us a little bit about it?
Sure. So we are a freestanding recovery nursery for infants that have been exposed to substances before birth. And what's unique about our program is that we use a model of care that really focuses on including parents in the care of their babies. Mm-hmm. So while our license is to care for infants up to the age of 12 months that have been impacted by substance use in utero, we invite parents and encourage parents. One parent at a time can come stay with their baby at Maddie's Place. And so while our nursing staff and our infant care specialists are focused on helping baby and supporting baby through their withdrawal process, our family advocacy team is wrapping around those parents to help them address literally any barrier that they would face to getting and staying in recovery, and getting to keep custody of their baby and just being amazing parents.
Wonderful. So I'm glad you mentioned that because that's one of the unique models that we have in the community. And if I understand, there's only a handful of places like Maddie's Place in the country right now.
Yeah, so while there are, clinics and hospitals around the country that do treat infants with what's called neonatal abstinence syndrome. So it's that collection of withdrawal symptoms that an infant is going to experience. Our hospitals, we've got a phenomenal hospital system here in our own community, but we are one of only 5 that we know of in the country that are freestanding. We're separate from the hospital systems. We operate more, it feels more like a home-like setting, not a clinic or a hospital. For infants that have got withdrawal and have some kind of comorbidity, we need those babies to stay in our hospital systems with neonatologists getting that really specialized care. But even if baby is experiencing severe withdrawal, even if they have a feeding tube or something like that, our staff are highly trained and capable of taking care of that. And so we've built good relationship with our hospital systems and encourage infants, hope infants will come to our clinic, and it's nearly one-on-one care. And so we don't have big fancy hospital equipment. Our model of care is what's referred to as non-pharmacologic. And I think that it's a little bit of a misnomer. It's not that we don't use medicated intervention or anything like that, but our model of care, we use specialized feeding and handling techniques that are really intended to keep baby regulated or help baby stay regulated so they don't get dysregulated, and then there's the need for medicated intervention. So as far as we know, we're one of only 5 in the country. The next closest would be either Dayton, Ohio or Phoenix, Arizona. So we're sort of the only ones in this region of the country.
Wonderful. Yeah, both beautiful towns, but they're too far away from us.
Exactly, yeah.
So actually, I read on the news that there is some maybe expansion on services, maybe some things happening. Can you tell us a little bit about that?
Oh, it's been a whirlwind. So our doors have only been open for about 2.5 years. We opened in October of 2022. And when we opened, we thought our services were covered by Medicaid. And we got about 5 or 6 months into operation and realized that was not the case. So we've been working really, really hard to... Maddie's Place is something new. We're sort of a square peg in a round hole. And so, the system wasn't exactly built for us. And so we're working on some legislative changes that will make it easier for these services to be available in our own community and across our state. And so right now we're actually operating as a state pilot project. So because we're not able to bill Medicaid and we provide all of our services completely free of cost to families, we worked with Senator Marcus Riccelli. He has been a huge advocate for us and went and advocated on the state level for us to get a portion of the state's opioid abatement funds that have kept us operating, provided a significant portion of our budget the last 2 years. And we had hoped we would be able to get our Medicaid plan here in the state amended. That was not successful. Obviously, there was a lot going on this legislative session, but he advocated again for us, and that pilot project was extended for another year. So we have funding at least through this time next year, and we're hoping that we have a really good chance to, be able to make some change on a legislative level that will provide consistent funding, and then these clinics can be available all over, not just our Spokane community, but across the state.
Wonderful. So thank you to Senator Riccelli for that. And I thought that there was some news about additional property.
Yes. So Spokane County has been a huge supporter of Maddie's Place. And so we were successful in receiving a grant from the county this last summer that allowed us to close on a piece of property directly adjacent to our current clinic. We're located at 8th and Arthur, so we're in the beautiful South Perry neighborhood here in Spokane. And the piece of property was almost an acre next to our clinic now that we were able to purchase. And our hope is that in the future, it'll probably be a couple of years down the road, but we're going to work on it, that we will be able to expand our clinic. Right now, we have the capacity to care for up to 16 babies and 13 parents at a time. We would love to be able to add a third clinic to meet the need in our community, and be able to care for at least 24 babies at a time. We're finding that a lot of times infants are ready medically to be released from our care, but parents have so many barriers and things that they need to get lined up before they have a safe, stable place to go and be able to take baby to a home. And so we would love to see some clinically integrated transitional housing that will give us a little bit of extra time to work with parents and make sure that they're set up for success. And if we're really dreaming big, we hope to add maybe a primary care clinic and child care, and really make it a one all-encompassing campus that that our families can come to and stay connected with the peer community that we're building. And
wonderful. So thank you to Senator Riccelli. Thank you to our county commissioners. A little bit of work being done there, which is wonderful. We've talked a lot about the babies, and sometimes people don't understand how significant the need is actually in the county. Could you tell us a little bit about that?
Sure. So, when we first opened our clinic, we had it was anecdotal data. We didn't really have a lot to go to our legislature and prove like, hey, this is really a problem in our community, and there's a huge need for it. And so with that pilot project funding, the Healthcare Authority worked with WSU, contracted with WSU to do an independent study of our outcomes. They looked at the first 71 of our babies and 15 of our parents. And what they found in that study was that the rate of neonatal abstinence syndrome here in Spokane County in 2022 was 340% the national average from the prior year. So it showed we've got, and that was 2.5 years ago. So there wasn't data available past 2022, and so since then we've obviously had a fentanyl epidemic that's hit our community, has significantly impacted. So we know that there's increased need for our services, and it's not just here in our local Spokane community. We're able to care for parents no matter where they come from. We've had parents from Idaho and Montana and across Washington State, but we're seeing more polysubstance use in our community. Right. And so when you have an infant that's been exposed to fentanyl and methamphetamine, those withdrawal processes look very different. So when you don't know at what gestational age they were exposed and what combination of substances, on average, from that study, it showed that each baby had been exposed to almost 4 substances each. So, we really have to tailor our approach to caring for these infants. As amazing as our NICU nurses and doctors and neonatologists are, we're all struggling to, support these infants and figure out what is the best way to care for them. And so at Maddie's Place, because we can offer that really intentional one-on-one care in a home-like setting that's not a busy NICU, we're seeing really amazing outcomes, statistically significant outcomes that we're hoping to change the model of care, not just in our own community, but across the state, and it's something that we hope will be looked at nationally too.
So a couple of things I think are important for the community. One is, so we've all heard about the fentanyl crisis and the polysubstance use, but we haven't, when we talk about it, we usually don't refer to the neonates.
Yeah.
So, which I think is why it's very important that we bring this topic today, because they're also being impacted. And I think one of the misconceptions is, well, babies are born and then they move on. And that's not necessarily the case, as you pointed out. Any other misconceptions that people may have about the families or what happens there that you want to shed some light on today? I
really appreciate that question, because I think that there are misconceptions about people that struggle with substance use and addiction. It's, while the majority of the parents that we see come through our doors are experiencing homelessness, that's not always the case. It's not just, obviously you drive through our community and you see people that are struggling with that, and I think that there is judgment there on parents, and we don't always take a step back to look at what led them to that place. Maybe there was a decision made at some point, a bad choice, and at some point it's not a choice any longer. And we've seen parents come through that really struggled. This is generational trauma. This is generational impacts, and so when they didn't have great examples or didn't have a healthy home life, or substance use, mental health issues, whatever it was, that's something that they're making the choice to break that and provide a better life for their infants. It's not just folks that don't have a job or that are unhoused. It's people that have good jobs, social workers and business owners, and really substance use can impact just about anybody. And so, but it's possible. Healing is possible, and we've got a whole team that is there to support them through that, walk through that with them. Our family advocacy team, of the 6 people that are on there, we have 5 peers that have lived experience, and and 4 of them are actually alumni parents whose infants, some of them stayed, some of them didn't, but their infants all stayed there, and so they have a really unique ability to connect with parents and say, hey, I know this is really scary and this feels really hard, but you can do it, and we're here to support you. And it's not just the time that you're here in our facility, it's even after you and baby have left. We're kind of building this really big, beautiful family. So
wonderful. So I've heard a little bit about volunteers, and I was wondering if I'm just a member of the community, what can I do to be helpful to Maddie's Place?
Oh gosh, there are so many things. I think number one, if you have somebody in your life that has been impacted by substance use, and you know that there is a baby involved, please encourage them. Even if that person is still pregnant, or baby is 6 months old, if they are struggling and could use some support, please have them reach out to us. We work with DCYF and social workers and hospitals, but families can also self-refer. Okay. So all they have to do is pick up the phone and call. We want to support. We want to be there and offer resources. I think the other thing, we've got plenty of volunteer opportunities. We've got, you can go to our website and sign up to be a baby cuddler, or
Can you explain what that is?
Sure.
I've seen
it. We've got a position that we call a baby cuddler, and so you go through some specialized training to understand sort of the work that we're doing and the special handling techniques and things that we use, and how to interact with our families and be really supportive. You don't have to change diapers. You don't have to feed. You just get to come cuddle babies. And really, it's just being an extra set of hands in the nursery and offering these babies love and connection. And it's a whole lot of fun. So I think we do have a waiting list at the moment, but go ahead and get your name on there. We would love to talk to you, but we've got so many other opportunities to volunteer. If you love gardening or yard work or something like that, if you have a special skill or you want to come make a meal, we would love to talk to you. If you've got an idea, please pick up the phone or reach out. I think the other thing that I would be remiss if I didn't say it is we are operating as a pilot project right now now, our funding is not secure, and so we rely heavily on donations. I'm working as hard as I can to write grants and really diversify our funding, but we cannot. We need donations from our community. So if somebody wants to come take a tour or talk more, I would love to offer that up. So yeah, we've got a wish list of things that we need, diapers and wipes and
All the baby things.
Yes, all the baby things, but things for our parents too.
For
As
the parents,
they're
yeah.
transitioning out and getting their first apartment or something like that, laundry baskets and towels and things that laundry soap, things you need to set up your first home and make it a really welcoming, safe home for baby.
Wonderful. I actually happen to know a couple of the parents, but I'm not going to say who they are, but they're doing great. So I do appreciate that. If you haven't been there, as you mentioned, you can call and maybe schedule a tour if you're interested in learning more or maybe helping a little bit. The reason why I focus on the cuddling is because these children do need human touch. Mm-hmm. It's part of the process, and that's very, very important. Although I do have to say, when I got my first tour, I don't know, a couple of years ago at the beginning, it's the first place I saw the automated bouncy thingies, which
A mamaroo. Yes.
yeah, which have a technical term, smart bouncers.
Yes.
Which I didn't know, just call it automated bouncing things. But it is quite an impressive environment because it feels like you're going to somebody's home.
Yeah.
Big difference, they just happen to be more than one baby.
Yes.
And there happens to be more than one parent. It could be the mother, the father, whomever is staying with the baby at that particular point in time, and then you have the volunteers who are actually holding those
Yes.
babies.
Well, we also offer visitation as well. So if there's, maybe baby is staying with us and a parent has determined that maybe this isn't, they
Sure.
would prefer not to stay, or even if a parent is still actively using, they have to be able to provide a clean UA to come stay at Maddie's place, we encourage them to come visit. We've got, supervised, safe visitation area, and it gives our team a chance to connect with those parents. But one of the things that we're really, really proud of, and I think that makes Maddie's Place stand out, is we've been able to serve, I think we've served 138 babies. We're getting ready to do several more intakes this week and next. And we've had more than 90 parents come stay with their infant at Maddie's Place. And of those 90-something parents, 95% of them are still currently in custody of their baby, sober, and housed. So those are really amazing. That's a really amazing statistic that we aren't finding anywhere else in our community or across the country. So we've got something special and unique here.
That is correct, and that is important for people to know. I'm glad you mentioned the UA, that's a urine test, because we do need to make sure that you're not actively using. So there are some safety concerns around the babies and around the home, just for people to know that. So I want to say thank you to Katie, thank you to the team at Maddie's Place, and as I mentioned, our various members of legislative and administrative offices that are helping us. And shout out to Sean Cross, whom I know, and actually he took this on a few years ago and is doing a great job with the team. And you can't not meet Sean without him telling you the whole story about Maddie's Place, like within the first 30 seconds.
This is a
That's
passion
a
project for
passion
all of
for-
us. If you give us a couple of seconds, we're going to take an hour to tell you how cool this project is.
Well, that's how I got to know Maddie's Place, because I happened to connect with him and heard about it. So folks, if you're interested, they're up on the South Perry district. Unique place in the community, unique place in the country. We need to do as much as we can to give these babies an opportunity that's going to impact the rest of their lives. So with that, I'm going to say thank you again to Maddie's Place. Thank you to our community, and we will see you again next week, I think. Because the 4th of July is coming, but I can't remember when it is. But we'll talk about it next week, so have a great day, stay safe, stay well, and we'll see you next Wednesday. Thank you.